Hello and welcome. Today we're diving deep into a rare and serious kidney disease, renal cortical necrosis. This condition involves the death of tissue in the outer layer, or cortex, of the kidneys. Join us as we explore its causes, how it affects the body, and what can be done to manage it. Renal cortical necrosis is primarily triggered by a severe reduction or complete halt of blood flow to the kidneys. Several conditions can lead to this ischemic injury. In pregnant women, complications like abruptio placentae, postpartum hemorrhage, and septic abortion are significant risk factors. In newborns, it can occur due to severe dehydration or sepsis. Other causes include severe trauma, extensive burns, snake bites, pancreatitis, and even certain medications. Underlying conditions like disseminated intravascular coagulation, or DC, can also predispose individuals to this devastating condition. The pathophysiology of renal cortical necrosis centers around a profound disruption of the kidney's blood supply. When blood flow to the cortex is severely compromised, the renal cells, particularly those in the tubules, are deprived of oxygen and nutrients. This leads to cellular injury and ultimately necrosis or tissue death. The extent of necrosis can vary, ranging from patchy areas to complete involvement of the cortex. As the cortex dies, the kidneys lose their ability to filter waste products and regulate fluid balance, leading to acute kidney injury or kidney failure. Renal cortical necrosis is a relatively rare condition, making it difficult to accurately assess its true incidence. However, it is more prevalent in developing countries, where access to adequate obstetric care may be limited. Historically, pregnancy-related complications were the leading cause, but with improved maternal care, other factors like sepsis and trauma are becoming more prominent. The incidence in developed countries is generally low, but it still poses a significant risk, particularly in specific patient populations. The signs and symptoms of renal cortical necrosis can vary depending on the severity and extent of the kidney damage. The most common presenting feature is oliguria, or reduced urine output, which can progress to anuria, the complete absence of urine production. Other symptoms include flank pain, hematuria, or blood in the urine, fever, and signs of acute kidney injury such as edema, nausea, vomiting, and confusion. In severe cases, complications like electrolyte imbalances, metabolic acidosis, and anemia can occur, leading to life-threatening consequences. Diagnosing renal cortical necrosis requires a combination of clinical evaluation, laboratory tests, and imaging studies. Blood tests will reveal elevated levels of creatinine and blood urea nitrogen, indicative of kidney dysfunction. Urine analysis will show the presence of blood and protein. Imaging techniques like ultrasound, CT scans, or MRI can help visualize the kidneys and identify areas of necrosis. A kidney biopsy, although invasive, is often the most definitive way to confirm the diagnosis and assess the extent of the damage. There is no specific cure for renal cortical necrosis. Treatment focuses on supportive care and managing the complications of acute kidney injury or kidney failure. This may involve fluid management, electrolyte correction, blood pressure control, and dialysis to remove waste products from the blood. In some cases, a kidney transplant may be considered as a long-term solution for patients with irreversible kidney damage. Preventing renal cortical necrosis primarily involves addressing the underlying risk factors. In pregnant women, ensuring access to quality prenatal and obstetric care is crucial to prevent complications like abruptio placentae and postpartum hemorrhage. Prompt treatment of infections, prevention of dehydration, and careful management of conditions like DC can also help reduce the risk. Furthermore, awareness of nephrotoxic medications and their potential to damage the kidneys is essential. The prognosis of renal cortical necrosis depends on the extent of kidney damage and the presence of underlying conditions. In cases with extensive necrosis, the prognosis is generally poor, with a high risk of chronic kidney disease and the need for long-term dialysis or kidney transplantation. Recent research is focused on developing strategies to improve blood flow to the kidneys and protect renal cells from ischemic injury. Early diagnosis and prompt treatment are crucial for maximizing the chances of survival and preserving kidney function. Thank you for joining us as we explored renal cortical necrosis. We hope this information was helpful.